organizations share that one of the central Quaker values of community, that is, the idea of the public good, the idea that it is not possible for an individual to make himself through his own efforts. All societal betterment takes place through community, and that means that we must have social services that fully support our people at all levels. So just for a couple of examples of that, my daughter was born when we were on welfare in San Francisco, and today she's a CPA specializing in nonprofits, but if you ask her what she does, she'll tell you she's a dancer. I just checked on the status of the hospital where she was born, and they now serve about 80% people. This is San Francisco General Hospital. They now serve about 80% people on public assistance of some kind. So obviously healthcare is a huge need in our country, and we need to keep supporting it. The other one is my son's first girlfriend, while he was away at college, died because she could not get healthcare coverage. She was too proud to go and ask for any kind of welfare assistance. So she just stayed home with her illness until she collapsed, and someone took her to the hospital, but it was too late. Her name was Katie Lawrence. She died of encephalitis in about 1999, and we still remember her to this day. And it was because, they wouldn't take her on. So I hope you'll remember this in your deliberations. There are people who will die if they're not supported. Thank you.
My name is Beth Brunton, and I'm proud to be a public school teacher. And I'm here public school teacher. I want to start by saying thank you to all of you, of course, for all your hard work over the years. I'm so grateful to live in this community of Seattle, because although our schools are terribly underfunded, we survive better than many children in this state and in this country because of your generosity. The fact that our libraries are open now 7 days a week, our students are almost crying with gratitude. You have no idea. If you don't have a computer at home, if you don't have a safe place to read, people think libraries are obsolete. That's a lie. They don't. I gotta tell you something. Those libraries are so important to our children and teens, because it's a safe place, it's a warm place, a dry place. I hear rumors, it's just for the homeless. That's a lie. It's for kids too. In elementary and high school, kids need those libraries. Where are they going to do their homework? Where are they going to, study when the schools are closed? So I'm so glad when the libraries closed on Fridays. That was such a terrible, terrible thing, and nobody knew how terrible it was. And so anyway, thank you for the libraries, thank you for the community centers. When my kids have to leave school, they at least have a community center to go to. 1 minute left, better hurry up. So I'm just so grateful. You know what kids need to learn is more than me, the teacher, and the school. We need those libraries, we need the community centers. They need to be ready to learn. My children I teach students who have had trouble in school or dropping out or failing because they didn't have health care. When you don't have dental care, you know what happens? Your teeth get infected and you get sick. And you just can't believe it. Kids with root canals and blood pressure problems that are 16 years old. Have you heard of that before? They asked me, do I have a blood pressure monitor? And they're 16 years old. So this is just terrible what we're doing to our young people. And what I've got to say is, they need health care. What David Bloom says, they need homes. They need, the most important thing they need is hope, because they're really feeling unwanted and unneeded. They can't get a job. So if I had to say what they need, 5 things: jobs, 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 jobs. They're unexperienced and they have no connections, so they can't get a job. Without a job, they have no hope. Why should they bother going to school? Why should they bother learning? Their parents can't get a job, their brothers and sisters can't get a job. What do you think they're going to do with their lives? So I, of course, want money for more teachers, nurses, librarians, and I also want that Pentagon billions for jobs, paid internships for young people. When I was coming out of school, there was something called CETA, Comprehensive Employment Training Act, and VISTA, and everybody could get a job out of school because there was all these kind of jobs. We need those jobs again, the first job out of high school or college. And my saddest kids are kids who can't do well enough to go to college. Those kids feel like their life is over. They've gotten a message from Bill Gates that if you're not in the 1% on those standardized stupid tests, you're no good. The other 99% deserve a wonderful life too. So let's hear it for the 100% of all of our students. So thank you. Thank you.
My name's Carl Wyrock. I'm a family doctor at a community health center in Seattle, and I'm here to talk about healthcare. And first of all, we need universal access to healthcare for all Americans. We've heard that people say you need jobs. Well, you need jobs, but let me tell you about Molly. Molly works in an elderly care facility. She likes to take care of old people, but she has a lot of medical conditions. And just by working in this job, she does not have health care insurance, because that's what happens in a lot of jobs in America. You don't get health care insurance. Well, so when she works in her job, her diabetes gets worse and worse and worse, and she no longer can come to work anymore, and then she loses her job, and she gets on Medicaid. And guess what? She has health care for the first time. Her diabetes gets better, she feels good, and guess what? She goes back to work because she likes her job so much. She works hard, but she can't afford her medicine because she no longer has health care insurance. Her diabetes gets worse, and guess what happens? She loses her job again, and she gets on Medicaid, and then she gets health care again. And she gets better because she can take her medicine. You see a cycle here? Jobs don't guarantee health care. Even if you have a job, you may not be able to afford your health care, your insurance, your medicine, and you can get worse. So for poor Molly, we had to tell her not to work so that she could get health care insurance. And that was the only way she could take care of her diabetes. And speaking of diabetes, let me tell you about Tom. Tom drives a bus in South Seattle for a small company. He works 5 days a week, but his company doesn't have health care insurance. Tom has diabetes. So guess how he balances the budget? He uses his insulin 5 days a week, and when he's off, he just takes a holiday from his insulin. Well, that's how he makes ends meet. The bottom line, folks, is jobs don't guarantee health care. We need a safety net. We see these people all the time. And if we don't have a way of providing health care for our citizens who need it, then we don't deserve to be respected as the world's greatest power. Thank you very much.
My name is Mike Yarrow, and until I was 70, I was the health insurance private company's wet dream. I was never in a hospital for myself. When I turned 70, they discovered 2 cancers. Since then, I've had 6 operations, and I have another one coming up for the 3rd cancer. And luckily, I get a pretty darn good socialized medicine, which is Medicare. I think and it should be for everybody. Why do I, as I get to be an old fart, get it and nobody else gets it? You know, that's not fair. But I think I never saw all the bills. I think maybe total costs for my care in the last couple of years has been up towards $1 million. I saved all my life so that I could have something to retire on, and that would be gone by now if I'd had to pay for all that stuff. So Medicare, I don't know whether it works for everybody. It's worked so well for me, and why not have Medicare for all?